In this part, we will discuss the tests that we do in a regular practice with this tuning fork. There are mainly three tests that we do. One is a Rennie's test, one is a Weber's test, another one is the absolute bone conduction test. These three tests are very important from exam point of view and also during our daily practice as a screening test. I repeat that all these tuning fork tests are screening tests and it should be confirmed by either pure tone audiometry or by tympanometry. Now, the name of this tuning fork is Cardinal's tuning fork. It should be held along with the stem, and care should be taken that while after striking the tuning fork, while taking it towards the patient, the prongs should not be touched with the fingers or should not touch any part of the patient's body. If any part or the examiner's fingers touches the prongs, then it will dampen the vibration and the test will be faulty. So before I start with the test, I would like to show you how to hold a tuning fork. Now, before we start a test, the most important thing is taking consent of the patient that what we are going to do and explain each and every part that the test will involve. Now, after explaining and taking the consent comes striking the tuning fork. There are few places in our body where we can strike the tuning fork. One is the hypothenar eminence, one is above the elbow, and one is the anterior aspect of the thigh. Wherever we are striking it, it should not be too hard or too soft. Remember, it should never be struck on any hard surface. Then it will cause distuning of the tuning fork. After striking the tuning fork, we will hold it 3 to 4 centimeters away from the EAC of the patient. Now, we have to look here carefully that the tuning fork should not be held like this or like this. In the book, it will be mentioned that the vibrating tuning fork should be along the direction of the axis of the EAC. Now, EAC's axis is in this direction, and when I am striking the tuning fork vibrates in this direction. So here we should remember that this direction of the vibration and the direction of the tuning fork should match. So the tuning fork should always be held in this fashion, not in an inclined way, not perpendicular like this. Okay. Now we will start with the Rennie's test. The Rennie's test can be done depending on the intensity of the sound of the tuning fork or the duration of the tuning fork. Let us first perform depending on the intensity of the tuning fork. I have taken consent of the patient, I have explained the entire test, and now I will start the test. I am striking the tuning fork, I am holding it just behind the ear over the mastoid process. Care should be taken that this footplate of the tuning fork should touch the bare area at most possible, not over the hair, not over any other obstacles. It should be touched over the mastoid eminence. That will give a proper result. So after striking the tuning fork, I first place it over the mastoid process and ask the patient to give me an indication when he or she stops hearing the vibration. When that indication is given, I will bring the tuning fork and will hold it beside the ear for confirming the ear conduction. Now, in normal ear and in case of sensory neural hearing loss, the patient will tell us that he can hear the vibration is persisting after bringing it beside the ear. That means ear conduction is greater than the bone conduction. And in case of conductive hearing loss, when we bring the tuning fork, vibrating tuning fork from the mastoid process beside the ear, the patient won't be able to hear. So the result can be two things. One is ear conduction greater than bone conduction, another can be bone conduction greater than ear conduction. Now the interpretation can be, if ear conduction is greater than bone conduction, then it might be a normal ear or a sensory neural hearing loss case. And in case of bone conduction greater than ear conduction, it can be conductive hearing loss. In order to differentiate between a conductive hearing loss and a sensory neural hearing loss, we will have to do a Weber's test next. Now we will do Weber's test. Weber's test is a test which is based on the principle of bone conduction. Where are the places where we will hold this tuning fork? The best place is upper part of the forehead. If this place is not possible, if this place is not, we cannot get this place, suppose the patient is having a bandage over the forehead, then we should find some other places where we can, alternate places where we can hold the foot plate. Another place can be the vertex. Another place can be the mentile. But remember, beard should not be there. It should be clean. Another place is the incisor, upper incisor. You will ask the patient to open the mouth and touch the foot vibrating tuning fork over the incisors. If all these things are not available, lastly you can hold the vibrating tuning fork over the root of the nose. But best is to place it over the upper side of the forehead. If not, then the incisors. Now, while doing the Weber's test, same thing, consent has been taken, description of the test has been told to the patient. Now, how we do it, we strike the tuning fork, we place it over the forehead and ask the patient whether the patient can hear the vibration in one of the ear better, or the vibration is equal in both the ears. Now, the interpretation is, suppose this patient is having a conductive hearing loss in his right ear. So in Weber's test, what happens, the vibration will be heard louder on the ear with conductive hearing loss. And in case of sensory neural hearing loss, vibration is better heard with the normal ear. So what happens, why we see that Rennie's test should always be confirmed with a Weber's test, is that in Rennie's test there is a fallacy which is called a false negative Rennie's test. Now what is that? A patient is, suppose is having a unilateral sensory neural hearing loss or a dead ear. So this patient is having a dead ear on the right side. What will happen when we will do a Rennie's test? We'll place this tuning fork over the mastoid. The patient will not be able to hear the sound from this ear because this is a dead ear. What will happen? The sound will transmit, there will be a transcranial transmission and bone conduction will be perceived through the other ear. So the test result will be, I am placing here, I am testing the bone conduction of the dead ear. Patient will say I can hear the bone conduction, but when I am placing it beside the ear for ear conduction, the patient will confirm that he or she cannot hear the sound. So the result of the test will become bone conduction greater than the ear conduction, though the bone conduction is via this ear, not from this ear. So in such patients, when I will perform a Rennie's test, the result will become bone conduction greater than ear conduction. That means conductive hearing loss of right ear. But when we will perform Weber's test, according to the Rennie's test, the sound must travel to this ear because bone conduction is greater in this ear. But in reality, this ear is sensory neural hearing loss, this ear is having sensory neural. So in Weber's test, sound always go to the better ear. So there will be a contradiction between the Weber's test and the Rennie's test. That way, we can actually differentiate between a dead ear and a normal conductive hearing loss ear. The next test is called the absolute bone conduction test or the ABC test. Now in ABC test, this is also bone conduction test, and here the hearing condition of the patient is compared with the examiner, considering that the examiner is having a normal hearing. So in this case, what we do, we strike the tuning fork, we place it over the mastoid and we block the ear by pressing the triggers gently. Remember why I am saying gently, I will explain it later, but during ABC test, never push the triggers hard. So in ABC test, what we'll do, we'll strike it, we'll place it over mastoid and we'll gently press the triggers to occlude the EAC. And beforehand, we'll explain the patient to raise his finger or tell us when he or she stops hearing. Whenever the patient will stop hearing and indication is given, the examiner will take the tuning fork, occlude his ear and will place the tuning fork beside the behind the ear of the same side. If I am examining the right ear of the patient, I will confirm my right ear also, so that I can understand whether the bone conduction of the patient is less than mine. Now the result of this test can come as bone conduction equivalent to the examiner or bone conduction decreased to the examiner, considering that the examiner's hearing is normal. Now, another test in this regard, I will say another bone conduction test, it is called Galley's test. Galley's test is done in case of otosclerosis. What we do in the same manner, we will strike this tuning fork, we will place the tuning fork over the mastoid and will occlude the EAC by tightly pressing the tragus. Now here comes in Galley's test, the difference between this ABC and Galley's is that we are occluding the ear by pressing the tragus tightly. Why we are pressing it tightly? So that the air which is trapped in the EAC will force the tympanic membrane lateral medially, which in turn will fix the ossicular chain. So what will happen in normal condition, if we are doing this test and we occlude the ear by tightly pressing it, and in turn the ossicular chains get occluded, the hearing will decrease because it will hamper the transmission of the sound. But in case of otosclerosis, when the ossicular chain is already sclerosed and the bony movement is not proper from beforehand, so this test will not change, will not cause any change in the intensity of the sound. So this is Galley's test. In this regard, another important test for malingering is Chimani-Moose test. Now, Chimani-Moose test is also a bone conduction test. Suppose this patient is malingering that he is deaf to his right ear. When I will place a vibrating tuning fork over his head like this, he will say that I can hear the sound better with the normal ear. Suppose this patient is trying to malinger that he is deaf to the right ear. So what he will say when I place a vibrating tuning fork, that I can hear the sound through the left ear and cannot hear anything through the right ear. Now what I will do, I will strike the tuning fork again and will occlude this EAC by pressing the tragus of the better ear. Now in reality what should happen, the patient should continue hearing, because this is a test of bone conduction and sound is being conducted via the bones. But the patient will think that as the doctor has actually closed my normal ear, so I should say that I am not hearing at all. So then we will understand the patient is malingering.